Thank you, Global Health Initiative, Innovation Social Labs, and Unite for Sight for allowing me to deliver this proposal. My name is LRapsilber and I am a nurse practitioner. The opioid crisis has decimated our country, perpetuating the spread of hepatitis C. Young people are injecting drugs at an alarming rate. Identifying folks who have hepatitis C and offering them treatment is the best hope for virus eradication. Treatments can be delivered to patients in as little as 8 to 12 weeks with little side effects. Access becomes a huge issue. Many providers have long wait times for appointments, and there are some providers who are still withholding treatment to patients if they have not remained clean and sober for 3 to 6 months. There is no study data to prove that this additional withholding of treatment provides long-term benefits and outcomes. As a nurse practitioner, I've seen firsthand the patients feeling judged and stigmatized, and many thinking that they would never receive treatment for their infection. Virus eradication is key to preventing the spread of the virus. And during the rehabilitation phase, when patients are receiving treatment for their addiction, it's the best time to offer them treatment and hope to enhance their recovery. By bringing the patient treatment to the site is the most cost-effective way to deliver care to the patient. I would like to expand a treatment model that I implemented where I would go to the rehabilitation center and deliver hepatitis C treatment on site. No one is providing this type of innovation of care for patients with hepatitis C. I piloted my study program and I went to an addiction and rehabilitation center. I met with the administrators and we formulated a plan by which I would go to the site to deliver care to the patients on site. I met with the staff to go over what the selection criteria was, and when they identified a patient, they would contact me so that I could come see the patient, examine them, and provide hepatitis C treatment on site. I had 3 patients that were selected. I met with them, examined them, and ordered the treatment. The treatment was delivered on site, and the patients were given the full course of therapy. I did monitor their laboratory data at the end of treatment to look at their viral load, which was negative. It was reassessed again at 3 months, and that delivered the SVR, Sustained Virologic Response or Cure, and I'm happy to say all 3 were cured. The impact of this model of providing care where the patient is provides quality, high-cost care and reduces the number of patients that will be spreading the virus and ultimately reducing the burden of hepatitis C. By providing the service at site during their recovery provides them the best hope and the best chance for a cure. Curing patients of hepatitis C also reduces the long-term burden costs for progressive liver disease like cirrhosis of the liver, liver cancer, and transplants. I have started a practice dedicating myself to educating and treating patients with hepatitis C at the site where they're receiving their treatment. I'm the sole owner and responsible for the practice. I'm ready to take this idea to the next level, and I want to be able to access more patients and treat more patients. In order to do this, the money supplied through this funding would be a great help. I would use it to develop marketing tools so I could go to the facilities and identify who I am and how I plan on providing this care for them. I would be able to talk to the administrators and formulate a proposal in order to educate and train them to provide the treatment, and also a brochure for the patients so that they understand what hepatitis C is and how the treatment opportunity will work for them. I also will need to cover my costs to go to the facilities to provide this proposal, education, and training. And I also need a secure computer with an electronic health record so that I can access and maintain data and patient records. I also want to be able to deliver medications to patients who are uninsured or underinsured. I can provide the drugs, but I can't provide the services for the monitoring of lab work, and this can run anywhere from $400 to $500. So I'd like to be able to offer that as well. I plan to publish my findings upon completion of my treatments, and I also would like to find folks that want to be treated, become treaters themselves, and to provide mentorship and education so that they can be treaters. My goal is to end hepatitis C as a disease state in this country, and I'm hoping that this will be a first step towards that process. Thank you for allowing me to speak today.